Hello, and welcome to Self-Directed Transportation Training, a new service of the Level 1 Self and Individual Option Waivers, effective July 1st, 2022. My name is Lisa Cursillo, and I'm a Medicaid Health Systems Specialist with the Ohio Department of Developmental Disabilities. I'm joined by Scott Marks, Jen Meadows, and Christine Brown. Scott will start us off with the big picture ideas that led to the new self-directed transportation waiver service. Scott?
Hey everyone, my name is Scott Marks. I'm the Director of Operations for the Ohio Provider Resource Association. And I'm going to talk a little bit about some of the big picture and some of the history of how we got here as far as the state of Ohio implementing this self-directed transportation rule. So as far as the big picture, transportation is commonly cited as the primary barrier for community employment, integration, and community-based supports for Ohioans with disabilities. According to a study done by the DD Council in 2017, transportation remains the number one unmet need of people with disabilities across the state of Ohio. And it is the top unmet need when it comes to getting to work and getting to medical appointments, two things that are obviously very, very important. The study also went on to say that at that time in 2017, there were still 64% of Ohioans with disabilities that said that they have no access to vehicles when needed. So considering that, we want to think about how we got here and how that information kind of plays into the reason why we are looking at this self-directed transportation rule. So as we said, it's very difficult for people to access vehicles, whether it's for work, for medical appointments, or other necessary needs and supports. So several policies and advocacy from people with disabilities really drove the need for community-based integrated services and supports, of which to get there and do that, transportation is very important. In 2020, some of our waiver services were redesigned to better fund community transportation, and modified vehicles were added to our transportation service with an additional resource and rate accompanying them. But throughout that redesign, advocates continued to promote the need for greater flexibility and more options in transportation, such as things like Uber, Lyft, and other commercial providers that were not currently available through Medicaid waiver-funded transportation. And then really importantly, throughout the course of the pandemic, that really impacted many non-medical transportation providers and actually probably caused many to go out of business. So only further driving the need for more flexibility, more options for people with disabilities to access transportation in order to access their communities. So currently we have primarily three main HCBS, which are home and community-based transportation services. And those will continue as well as adding in the self-directed transportation service that we're discussing. So the first of those services is non-medical transportation. And that's a service that provides transportation to and from community employment and day service settings, including day habilitation centers and sheltered workshops. In 2020, the redesign added funding for community-based transportation and modified vehicles, as well as far as coverage for transportation so people can get transportation to volunteering, internship, and post-secondary education locations. So all of that was added to our NMT service in 2020. Community-based transportation, modified vehicles, as well as access to volunteering, internship, and post-secondary education locations. So in addition to regular NMT, we also have commercial NMT, which is providers who are publicly available transportation but are also certified through DODD, who can bill at their usual and customary rate. And then there's just our transportation service, or it's also called HPC transportation. And this is the service that's typically associated with our homemaker personal care service. And sometimes that service is provided on behalf of someone when maybe the individual isn't present in the car, but the staff is providing a service for them that requires them to travel to and from a community location. So with all that said, why are we looking at self-directed transportation? Why are we adding it into our waiver services when we already have those 3 services I just mentioned? Well, the reason is that there are a lot of additional benefits and a lot of people who could benefit from the addition of self-directed transportation into our waiver transportation services. So some examples of that are people who are working in the community, especially if they're working late night or weekend shifts when transportation is extremely limited at times, and transportation options, especially through our waiver, are oftentimes limited. Another example would be people looking to be more involved in community activities. When those activities also are in the evening, on the weekends, or at times when transportation has not been typically available, the self-directed transportation service is something that will hopefully be able to better take care of that. People looking for more community-based or typically available transportation providers. So again, by adding this self-directed transportation service, there will be new options, new capacity, new types of providers, such as public and commercial transportation providers who are not currently certified through our system, who can be brought in to provide transportation services through this self-directed transportation service. Also, people wanting to navigate the community independently without receiving another waiver service at the same time. Our other waiver services, as we said, like HPC transportation, NMT, are often linked with another service that is happening at that same time, whether it's a residential, a day service, or employment service. Self-directed transportation would allow options to only have the transportation to activities that are not necessarily connected with any type of service that's also happening at that time. And then again, really big picture is just people wanting to access transportation options that have been previously unavailable. That's really what the self-directed transportation rule and service is all about. So what does the new rule say? What is self-directed transportation? Well, the rule says self-directed transportation, it means a service that enables an individual to access activities and opportunities available in the broader community, such as competitive integrated workplaces, integrated community participation and contribution, community resources, and businesses consistent with the individual service plan. Self-directed transportation enhances independence as it is available around the clock, including weekends and holidays, to accommodate an individual's scheduled and spontaneous transportation needs. So looking at the features of self-directed transportation and why this is going to be such a valuable new service for people with disabilities in Ohio, in addition to our already existing transportation waiver services, it allows the opportunity for transportation that can be either scheduled or on demand. It allows greater access to integrated employment. It's much more flexible than our current options. It allows for more access to activities in the community. It leads to a greater pool of potential providers of that transportation service, and it also can be used for access to day and other day array and employment services as well. So again, a lot of reasons why we're looking at bringing up this self-directed transportation rule, and a lot of people that can benefit from it, especially keeping in mind what we saw in that previous slide about how much transportation and vehicle access is such an issue for Ohioans with disabilities, is really why we are implementing this self-directed transportation rule. Again, my name is Scott Marks, Director of Operations for Ohio Provider Resource Association. Thanks for listening to me talk about transportation. Thanks.
Hi, I'm Jennifer Meadows. I'm the Director of Medicaid, Contract, and SSA Services for Hamilton County. I'm here to talk about self-directed transportation. Specifically, I'm going to talk about how this service can be authorized and paid, and look at some specific examples of how a person might access the service in their community. First thing we're going to talk through are those options for how the service can be authorized and paid. There's 2 ways to do this. The first way is through the use of prepaid vouchers, gift cards, tokens, or passes that can be used to access modes of ground transportation that are available to the general public. If a person's using this prepaid method, they are accessing a vendor's services at that vendor's usual and customary rate. That's known as the UCR. So that's option 1. Option 2 is a reimbursement system. Under the reimbursement system, a person or entity identified by the individual who meets the qualifications within the rule is reimbursed to provide the service to the person. And under this reimbursement method, there are two ways the service can be paid. It can be paid on a per trip basis or on a per mile basis. We're going to talk more specifics about both the prepayment or the reimbursement system here in just a minute. As far as budget for this service, there is not an annual cost cap on self-directed transportation as a service. Instead, each team should work with the individual to consider the person's identified, assessed needs, their preferences, the other services they have authorized under their waiver, and a general look at their waiver budget for the span year to determine what's appropriate to be authorized for self-directed transportation. We talked about there being two ways to set this service up. Let's talk about who might provide that under each method. The first way we talked about, if you recall, is a prepaid service method where vouchers, tokens, or gift cards are purchased ahead of time, and the person then uses that to purchase ground transportation, and that's paid out at a vendor's usual and customary rate, the UCR. Examples of this would be a person could use these to purchase services from Lyft, Uber, other rideshare services, taxi services, or publicly available ground transportation such as local or regional transit through bus service. So that's the prepaid method. The second way we talked about is the reimbursement method. If you recall, under this, services are paid out at either a per trip or per mile rate. And there's two groups that can be authorized under this method of authorization and payment. The first is that the individual can identify a family member, a friend, coworker, honestly, anyone the person knows in their life who meets the criteria who's willing to do this. The second group under reimbursement is our DD certified providers of other modes of transportation. So the non-medical transportation service or the homemaker personal care or HPC mileage or HPC transportation. Those providers may also provide self-directed transportation so long as they first enter into agreement with the FMS. And we'll talk more about the FMS. Before we move on, I want to talk a little bit about family. I did mention family can provide the service, which is true, but there are some important limits that you need to be aware of. First, parents or guardians may not provide services to their minor children. And second, guardians of adults may not provide services to their ward unless approved by the probate court. So keep those things in mind as you plan. A little more about becoming a provider of this service. Regardless of whether it's an individual the person identifies or an agency that agrees to do the service, before the service can be authorized or paid, the entity or person must enter into that agreement with the Financial Management Services Entity, or FMS. And it's critical that that occur before services begin. A little more about the FMS. We've mentioned them a few times. The FMS plays a critical role in the authorization and payment of the self-directed transportation service. Unlike our other waiver services, this service is not billed through DODD. Rather, it is billed through the FMS. And that holds true whether we're using the prepaid options or the reimbursement system. Everything runs through the FMS. I want to talk a little more about specifics on the per trip rate versus the per mile rate. If the service is authorized and paid at the per trip rate, that is a negotiated rate. The individual can negotiate that rate as low as the person agrees to do it, all the way up to a cap of $12 per one-way trip. And that cap applies whether it's an individual or an entity or agency providing the service. Under the per mile method of reimbursement, the rates are in the rule, and that is not a negotiated rate. So the rates listed are the rates that are paid for miles, regardless of whether it is an entity, an agency, or a specific person.
Christine, how can someone become a provider for self-directed transportation?
People, families, friends, neighbors, coworkers who want to become providers of self-directed transportation must apply through the FMS entity, not have 6 or more points on their driving record, hold a valid driver's license, hold valid liability insurance as specified by Ohio law, complete also a background check. with Ohio Revised Code.
Can a certified provider of non-medical transportation or transportation provide self-directed transportation?
Yes, they can. And to do so, they will need to apply via the FMS. Certified providers will be processed quickly through the FMS. Those certified as providers of commercial non-medical transportation will be able to bill the usual customary rate. Non-commercial certified providers will only be able to bill the established per mile rate or a negotiated per trip rate up to the $12 trip cap.
What are the 3 ways self-directed transportation services can be paid or reimbursed?
The 3 ways that they can be paid or reimbursed include the usual and customary rate only for commercial providers available to the general public, per mile or per trip.
Which providers can bill the usual and customary rate?
The providers that can bill the usual customary rate include Uber or Lyft, other rideshare services, taxi, public transportation.
Which providers can bill per mile?
Certified DD providers, other providers under agreement with the FMS entity.
And which providers can bill per trip?
Certified DD providers, other providers under the agreement with the FMS entity. And it's negotiate rate up to cap.
Jessie Russell lives in Delaware County and receives transportation through her waiver. Christine, what has she told us about using transportation services?
Jessie uses Uber 5 to 6 times a week with the self-waiver. Uber takes her to work, home, to get her medicine and get her nails finished. Jessie's parents used to drive her. She says self-directed transportation is better because it gives her freedom. She has been using Uber for close to 4 years.
Christine, you use self-directed transportation with your waiver service too. Can you tell us more about it?
I use self-directed transportation under PDGS right now, and it pays for me when the new self-directed transportation starts and it is effective. I will change to that service. My budget is $13,000 each year. In my ISP, I have $10,000 for Yellow Cab and $3,000 to buy Uber gift cards. The $3,000 is divided into $1,500 for the first part of the year, and second part of the year is the rest. And I use it to take me to the doctor, going to meetings like DD Council, and to visit friends or spending the night with somebody. And I work at the Ohio State University Nice-Longer Center and usually take Yellow Cab. I started this in 2012 when the self-waiver was created. Before that, I had mostly relied on staff, parents, or CODA mainstream. CODA had to be scheduled at least 24 hours ahead and came really, really early, and I would get to work before the place opened and had to wait outside, and it was terrible in the winter. With this service, I feel more independent and can get what I want when I want and don't rely on others.
Thank you, Christine, Jen, and Scott, for helping us learn about self-directed transportation, and thank you to everyone for watching. The Ohio Department of Developmental Disabilities has several resources available on our website to support teams with this service. Please contact us at waiverpolicyta@dodd.ohio.gov with any questions.